Hi there, welcome to the virtual cardiovascular rehabilitation program orientation. My name is Katie. I'm one of the nurses here on the team. And today we're going to just discuss the basics of our program, some very basic information about cardiovascular disease and cardiovascular disease risk factors, as well as we would like to share some resources with you that you may find helpful in your recovery and rehabilitation. So I'd like to start just by talking about the basics of our program. The cardiac rehab program is designed to support people who are at high risk for cardiovascular disease or those who are living with cardiovascular disease to improve your overall health. We encourage you to learn about your condition and work with our team to develop and accomplish your health-related goals. This is an outpatient program based at 1040 Oliver Road. At this time, we are offering our program virtually by telephone or WebEx. We're doing this because of enhanced safety precautions related to the COVID-19 pandemic. This virtual 12-week program offers you education, counseling, and exercise from our team of trained professionals. I'll just take a quick minute to outline what our team looks like so that you are aware who you may have access to throughout your 12-week virtual program. So at this time, we're working with Dr. Ellen Melton. Dr. Melton does oversee our program, and she will see some of the participants entering our program for an intake assessment. She will do this with people who are deemed higher risk to assess your safety for participation in our program at this time. This assessment may also be completed by a nurse practitioner, and we will certainly inform you of that when we are scheduling your program. Please be aware that these practitioners will not take place of your community providers. If you are seeing your family doctor or nurse practitioner or perhaps some specialists in the community, please continue to do so as scheduled, as Dr. Melton and the nurse practitioners that do sometimes help us out are not available in our clinic regularly. So they will only be seeing you if you are deemed higher risk for participation in the program. We also have kinesiologists on our team. A kinesiologist is kind of a fancy term for an exercise therapist. These are the folks who are going to be set up with you to provide your exercise program and also provide you with some education related to activity in your day-to-day life. We also have registered nurses on our team, and we will be seeing you in different capacities throughout your program. We have a program dietitian on site. Her name is Nicole. We're very lucky to have Nicole on our team. She provides a lot of programming, education sessions, as well as individualized counseling appointments. Nicole is also a certified diabetes educator, and she's a wonderful resource for all things related to nutrition. We have a social worker in our program as well that joins our team every Friday at this time. Her name is Rayanne, and Rayanne also works on the inpatient cardiac and stroke unit, so she may actually be a familiar face to some of you folks. You'll see Rayanne, our social worker, offering education sessions as well as individualized counseling. Please let us know if you are interested in speaking with Rayanne for any appointments, as we don't schedule these as regular appointments in your 12-week program. We also, of course, have a program manager, and his name is Kyle. Kyle is very much a part of our team. He rolls up his sleeves and jumps in wherever needed. If you do ever need to connect with him to provide feedback or ask questions, you can certainly do so through our main contact number, and we'll make sure to connect you with him as needed. We also have a full-time as well as a casual receptionist in our program. Dina is our full-time receptionist, and she is quite honestly the glue around here. She keeps us organized and will be responsible for scheduling the majority of your appointments. She's also sometimes supported by a casual receptionist named Laura, and we're very lucky to have Laura here at times as well. Our program is, of course, also supported by dedicated volunteers. Now, due to the COVID pandemic, we're in a bit of a limbo phase where we are trying to reintegrate them back into the program safely. So at this time, we're not offering a lot of services from our volunteers. Changes, we will certainly keep you updated. Now, I just kind of like to outline, an example of what your 12-week program would look like. Now, please note that the participants that are connected today from the region may actually have slightly different programming, and this is dependent on how your community program is operating at this time. Telemedicine intake appointments will be offered whenever possible. So for those of you who are attending locally, you can expect these appointments in your 12-week program. So you will be scheduled for a one-on-one in-person assessment with a registered nurse. At this assessment, we do ask that you wear a mask into our facility. We also ask that you bring a medication list with you to this appointment. During this appointment, we're going to do a physical assessment. We're also going to take some measurements. We will review your medication, your medical history, your lab results, and of course, answer any questions that you may have at this time. This is a really good opportunity for our team members to get to know you. We do look forward to these in-house assessments at this time, noting that most of our programming is taking place virtually. So again, this appointment will be one of very few that may be scheduled within our clinic at this time. Now, we had briefly discussed, dependent on your medical status, you may also be scheduled for a one-on-one in-person assessment with a physician or nurse practitioner in our clinic. Everyone will also be scheduled for a one-on-one virtual consultation with our program dietitian, as well as a number of virtual group education sessions. So we will schedule each of you for a session with a registered kinesiologist. This is going to be a group education session that will occur virtually. It's called Exercise as a Lifestyle. We also have a registered nurse offering cardiovascular medications in a group education session format as well. Our program social worker offers 2 education sessions, one on stress management and the other on healthy sleep. And of course, our program dietitian also offers a number of education sessions. At this time, we are currently offering heart healthy eating, label reading, meal planning, as well as grocery store shopping. Now, of course, many of you are probably quite interested in how we develop an exercise program. So this is going to take place virtually as well. Each person is going to be assigned a registered kinesiologist as a case manager. They're going to initially contact you to get to know you a little bit, understand where you're at today and what your goals may be, and of course discuss any limitations that you may be experiencing. After that time, your case manager is going to develop and establish an exercise program with you and for you. And then they're going to follow up a number of times throughout your program to see how you're doing and offer you, some progressions and perhaps a review of how your program is going. Closer to the end of your program, you will be offered a virtual discharge discussion with your case manager as well. An example of what may occur at an appointment like that is a discussion about, what your plans are after you graduate from the program. If you do have any questions, this is a great opportunity to get some advice from your case manager and make a plan for, how you will proceed with these healthy lifestyle choices. Okay, so that's just kind of an example of what your 12-week virtual program will look like. Again, please keep in mind if you are connected today from the region that your program may be slightly different. And this is dependent on how your community program is currently functioning at this time. This is a great time to also mention that each of you are going to receive a handout package from our program. Now, this package is going to include a number of things. Firstly, it's going to include a schedule of all of your appointments and your 12-week program. In addition to that, we will include all of the handouts for the virtual group education sessions, as well as some basic exercise log sheets and a few other resources and some information. This package is wonderful for you to have at your fingertips. You can access it as needed, but of course, you're also welcomed to pull out your education handouts and follow along with the sessions when you do connect to the education sessions. You can also just take a look at this really at any time that works well for you. Review the information after your graduation, for example, as a quick refresher as well. Now, just a little bit more basic information about the program. The education counseling as well as the exercise is covered through OHIP at this time. So there is currently no charge to participate in the virtual cardiac rehab program. Now, if you are someone who lives locally or you are scheduled for an appointment in-house at 1040 Oliver Road, there is a fee associated with using the parking lot. The parking system is exactly the same as over at the Thunder Bay Regional Hospital main site. It's a token system. There is a pay station that's located in the main lobby area of 1040 Oliver Road. If you ever run into issues entering or exiting the parking lot, please know there's a call button that is located at the gates as well as the pay station, and you can simply push this button as needed. And a security officer should come over the intercom system and be able to speak with you and troubleshoot whatever you're experiencing. Just a friendly reminder to please practice proper hand hygiene when you're handling the tokens or touching the pay stations. And know that there is definitely an abundance of hand sanitizer available in the building. There are some pumps located outside of the elevators, as well as a number of stations set up in our office. We do have a no-show rule, so if you are scheduled for appointments in our clinic or virtually, we do expect you to attend these appointments. Please let us know if you're not able to attend an appointment. If for any reason you don't attend a number of appointments and we lose contact with you, you will be withdrawn from the program. So that just means, you know, if you don't show up for a number of appointments and we can't reach you by email or by telephone, we do have to withdraw you from the program at this time. Okay, so we'll change gears a little bit. Again, this is a very brief orientation session, and we have chosen to really, you know, focus just on the basics, the need to know information at this time. In the past, we provided a lot of education about cardiovascular disease, lots of information about different diagnoses, surgeries, etc. And we just found that it was the wrong time to provide you with this information, and it was quite overwhelming. So again, this is really just quite basic information about cardiovascular disease in general. So cardiovascular disease can refer to a number of conditions, including but not limited to heart disease, such as coronary artery disease or plaque buildup in the walls of the arteries in our heart. Heart failure or congestive heart failure is another condition where our heart chambers are not pumping as well as they should be. Our heart, of course, continues to work, but the rest of our body may not be getting enough blood and oxygen. So this condition is a little bit trickier to manage. It does require closer monitoring in most situations, but we certainly see a lot of patients coming through our program living with this condition as well. Heart valve problems, as well as arrhythmias, abnormal heart rhythms, and heart attacks. Now, we talk quite a lot about risk factors for cardiovascular disease within our program. I think it's just a good starting point to kind of take a look at these things and see if any of them relate to you and your health. And you can certainly establish some goals and work on those goals with our team within your 12-week program here. Now, for those of you who may have received a handout package, or if you were hospitalized, you may have actually gotten a handout that is printed by the Heart and Stroke Foundation. It's called "Are You at Risk for Heart Disease or Stroke?" This little handout is just kind of the Coles Notes version of all things related to risk factors for cardiac disease. It's a great resource to keep close, to keep in your handout package and refer back to as needed. But also to take a quick look at, prior to starting the program, if you do find it interesting or relevant to your needs. Okay, so cardiovascular disease risk factors are split into two categories. Non-modifiable risk factors are one category, and they include our age, gender, family history, ethnicity, as well as our genetics. Now, the modifiable risk factors we tend to focus a lot more on because we do tend to have more control over these things in our lives. So physical inactivity, of course, can contribute to the risk for cardiovascular disease. Not getting enough exercise can actually contribute to diabetes as well as heart disease, and it can lower the amount of good cholesterol that's in our body. We recommend starting slowly, setting weekly goals to increase your level of activity over time, of course, as appropriate and within the guidelines and restrictions that you have been provided, either by your surgeon or your community practitioners or perhaps our team. Try to look for opportunities to be active every day, taking the stairs, parking further away and walking, playing outside with the kids or grandkids, etc. And of course, we will eventually have you set up with a case manager to develop a plan that works well for you. Unhealthy eating patterns and food choices can, of course, also contribute to cardiovascular disease. We're really lucky to have a registered dietitian on site. As I mentioned, her name is Nicole, and each of you will be scheduled for an individualized assessment with Nicole. You'll also have the opportunity to attend a number of education sessions related to nutrition within our program. We know that eating a healthy, balanced diet is one of the most important things that you do to protect your overall health. This will help you by improving your cholesterol levels, reducing your blood pressure, and maintaining a healthy body weight, as well as controlling your blood sugar. Stress is also listed here as a modifiable risk factor. We know that high levels of stress can cause our heart to work harder and actually increase our blood pressure. We do offer a stress management education session, and we have also linked some mindfulness videos for you to check out if you're at all interested. Smoking, of course, is a risk factor for cardiac disease. We know that carbon monoxide and many of the other harmful chemicals in cigarette smoke cause heart health problems, including damage to our arteries. We know that this damage can cause plaque to build up in the arteries, which can block or reduce blood flow. And we know that it also decreases the amount of oxygen within our bloodstream. Smoking can actually increase your blood pressure and make your heart work quite a bit harder. So we certainly encourage avoiding smoking and exposure to secondhand smoke as well. We are trained in smoking cessation, and we can certainly offer you smoking cessation support and appointments in our clinic if you're interested. So please let us know, and we can book those as needed. Alcohol is also listed as a risk factor for cardiovascular disease. We know that too much alcohol can increase our blood pressure, weight, and overall risk for heart disease. It can also impact the efficacy of our medications, so how our medications work inside of our bodies. And both the Heart and Stroke Foundation as well as Health Canada put out some very general guidelines for alcohol consumption. They say that for females, we can have a daily maximum of 2 alcoholic beverages to a weekly maximum of 10. And for males, they recommend no more than 3 alcoholic beverages per day to a weekly maximum of 15. Now, that being said, we know that we are all individuals. We all potentially have different underlying conditions, health, medications on board. Folks, if you are someone who is consuming alcohol, have that conversation with your community practitioners. Let them know what your habits are, and see if they have any recommendations or guidelines that may be more specific to you as an individual. Blood pressure, cholesterol levels, as well as high blood sugar levels can all contribute to cardiovascular disease. We have a lot of information available about maintaining and managing these conditions. Please let us know if you have any questions, and we can certainly provide you with that information. We also talk about large waist size as a risk factor. We know that carrying extra weight around our abdominal area can increase our risk for heart disease, diabetes, hypertension, as well as cholesterol. High cholesterol. We encourage you not only to focus on the number on your scale, but also what you're putting into your body, how your clothing's fitting you, and how you're feeling overall. A great resource, to discuss this further, it would definitely be our program dietitian. So don't be shy to ask these questions in your individualized appointment with Nicole, or reach out to any of our team members if you're curious or you have further questions in that regard. Okay, so again, don't forget there's a nice little handout that summarizes this information quite nicely. Again, I certainly haven't covered all the details of risk factors for cardiovascular disease, nor cardiovascular disease in general. But again, we'll provide some resources at the end of this presentation. And we also have some handouts available in our clinic that we can certainly provide you with if you do not have access to the internet. So we're going to actually start wrapping up now. I just want to give you, some key information from today's session, and then we will finish up by reviewing the references and resources we would recommend utilizing if you're doing any independent learning. So firstly, I just want to remind you that you will all receive a binder, including your program schedule, your educational resources, exercise log sheets and information, as well as handouts for all of the education sessions in our virtual program. Secondly, please be aware of the risk factors for cardiovascular disease. Learn what you can do to decrease your own risk. Please attend your scheduled appointments. If you're not able to attend, please notify us as soon as possible. We will either reschedule that appointment or find another way to provide you with that information. A friendly reminder to please have your lab work completed today or tomorrow if you haven't already had it done. Learn the signs and symptoms of cardiovascular disease. If you do experience signs and symptoms, treat them as warning signs and seek medical attention. Please use reliable resources for independent learning and research related to cardiovascular disease. Excuse me. The last slide that we will show here today has some suggestions for good online sources of information. As I've mentioned, handouts can also be provided to participants who do not use the internet. And if you're ever unsure where to start, please just ask our team. Please feel free to email any follow-up questions, comments, or feedback in relation to this orientation session to the email provided in the slideshow presentation. Alternately, you are welcome to contact me through the main clinic number, which is 807-684-6780. I want to thank each of you for your patience and understanding with our new virtual program. We're super excited to offer something during this difficult time. We understand that it can certainly be difficult to navigate at first and to adjust to, but we're getting some good feedback from the participants who are attending and who have completed the first few rounds of our program. So we're excited to work with you, and we're hopeful that you find this program beneficial. That being said, this is really new to us as well, offering this virtual program. And we're certainly always open to feedback and suggestions. So throughout your program, if you do have any recommendations for us or feedback, good or bad, we're certainly open to that because we want to meet your needs the best that we can and make sure that you're getting the most out of this program. Okay, so lastly, I just want to share this information with you here. Folks, be very careful if you are doing independent learning, especially if you're doing that learning online. There's a lot of misinformation on the web, so we provided just a few websites here that may be beneficial as a starting point if you are doing any research on your own. So you'll see that the Heart and Stroke Foundation of Canada is listed there. There's also a link if you're interested at all in completing a self-risk assessment tool. You can certainly use this tool to, see how you're doing today and get a little bit of feedback. Thirdly, we've shared the Cardiac College website. It's a great resource, for all things related to cardiovascular disease and recovery. They have pre-recorded education sessions. They have recipe ideas. They have exercise guidelines. It's a really great resource for information, especially for you as the patient. Ottawa Heart also offers a pretty excellent website. You're more than welcome to take a look at that as interested. Some of the information that is used in our stress management presentations as well as our sleep presentations is taken off of this website here. You guys are welcome to take a look at it and explore as you find interesting, and know that we also have handouts from this website printed in our office if you're all interested. Now, I had promised we would share a link for practicing mindfulness. One of the practitioners over at Thunder Bay Regional has pre-recorded some mindfulness sessions. There's a 5, 15, or 30-minute session available for you to follow along with at this web link. I encourage you to check it out and keep an open mind, and also to try it more than one time. I think that mindfulness can be a tricky thing to practice, but the more that we practice it, the more benefit you may notice. So take a look at that if you find that interesting at all. We also shared a link for an online cardiac support group that is patient-specific. So it is out there for people such as yourselves, just to connect with one another and, recover together, share some information, and perhaps find some support. This is a great resource in, the absence of being able to invite each of you here to participate in a program together and get to know one another. So it is a nice way to connect with others who may be in a similar circumstance to yourselves. If you're looking for that type of support, it might be something to check out, pardon me. And lastly, we've just shared a phone number as well as a web link for smoking cessation advice and support. So folks, you're welcome to look at this, peruse this information, as you have the time or you find it interesting, and you're always welcome to bounce off of our team if anything comes up during your 12-week program. Again, thanks so much for your time and your patience. Have a great day, and we are looking forward to working with you. All right, take care. Bye for now.